Morning. How everybody sleep? I hope say all man sleep well. Me, when they talk to on us, na my name Matthias Sandy.
Community health worker Matthias Sandy announces the arrival of a mobile vaccination team in Bandama, a community just outside Kenema town in the east of Sierra Leone. This is one of 3 teams deployed by Focus 1000 in Kenema district as part of an ongoing COVID-19 vaccination campaign by the NGO and its partners. As the social mobilizer in this team, Sandy has to go around the community to inform residents about their presence and encourage those who are eligible to come out and get their shots.
Sometimes you need to have better explanation which you will give people for you to convince them that, oh, this vaccine is good, or even the vaccination card also is good. So you really need to explain to them.
This is the 3rd visit of a vaccination team to this community since Sierra Leone launched its campaign against the pandemic in March 2021. And therefore, majority of the residents are coming for their 2nd or booster doses. Sierra Leone in December 2022 reached the milestone of fully vaccinating 70% of its eligible population, with 71.2% coverage, making it one of only 4 countries in Africa to have attained the World Health Organization global target by the end of 2022. Focus 1000 is one of several local and international partners helping the government in this effort. This exercise is part of a 9-month campaign by the local NGO with support from the Mastercard Foundation, the Africa CDC, and the Dakar-based Institute for Health Research, Epidemiological Surveillance and Training. The project had the objective of setting up 45 new COVID-19 vaccination centers and supporting 20 existing ones, with the overall goal of increasing uptake of the life-saving commodity in Sierra Leone, one of the countries with the least number of people vaccinated against COVID-19 at the time. The Ministry of Health is leading the campaign, and here in Kenema, Fode Bawo coordinates the efforts of the ministry's expanded program on immunization, or EPI. His team ensures that the vaccines are available, and it directs the activities of the various partners in the district.
We do coordinate by looking at the individual teams, where are they operating. Like as of now, we have divided the whole district into sections where each of these supported teams are operating. Like the Focus 1000, for today, they are heading for Dama area. They do operate in areas that are being coordinated by the team here, and that team is led by the DOO. And that
Every morning, volunteers from the various teams assemble here at the EPI Center in the District Health Management Team office to collect their supplies and get instructions on deployment locations. This man apportions the vaccine vials in each container for a team. Amara Sharif, the vaccinator on the Focus 1000 mobile team, is at hand to pack their consignment before the arrival of his colleagues.
For the campaign that currently is going on, we have 132 teams, and these teams are separated all over the district in all of the PHUs. And every day we have to make sure that these teams go to work and we collect their data from them and then send it to national. Then we also have COVID-19, which UNIVAC. UNIVAC is supporting 21 CHCs and 1 mobile team on also COVID-19 vaccination for the process of 8 months. And we have Focus 1000 supporting 3 teams with 1 static team for the period of 8 months also. But these teams are not located all in Kenema Township here. We have one of the teams in Guama Mende Chiefdom, we have another in Nomo Farmer Chiefdom, and then we have one in Nongowa here. But the one in Nongowa here move all over the district because they are using vehicle. The one in Guama Mende has motorbike, which Focus 1000 supply them, and the one in Nomo Farmer also has motorbike, which Focus 1000 supply them. But for the one in Nongowa here, DHM team is supporting them with vehicle. So every morning the team members have to come to DHM team, as you can see them there, even over there. They can onboard the vehicle and then they go out and work.
As of March 2022, only 14% of Sierra Leone's population had been vaccinated against COVID-19. Mass vaccination campaigns like these by Focus 1000 have been instrumental in the country's success against the pandemic. A total of 15 such campaigns were mounted by all partners between March 2021 and February 2022, accounting for 74.5% of the COVID-19 vaccinations since the rollout. The Ministry of Health intends to build on this success by expanding coverage to hard-to-reach areas. And for this to be realized, the role of volunteers like Sandeep is vital. Here in Bandama, he explains to anyone who cares to listen why they should take the vaccine.
So before you say it, Fabino, meet me then, yeah? Mommy, please, meet me, no verify, yeah? Now, Mr. Amadia, you don't take the vaccine? How many? Now one, we go to Kalo verify you. Please.
One by one, they come out and head to the location where the team is set up. Some seek clarification about their vaccination status. This lady had taken just 2 doses. She needs the booster dose. She is advised accordingly. Her husband calls out through his window, also seeking clarification on his status. Most of the residents here have had at least 1 dose of a COVID-19 vaccine. A few, like Sarah Bangura, are coming for the first time. Like many Sierra Leoneans who hesitated to take the vaccine at the early stage of the campaign, Sarah had her fears. But with Sandy's persistent but smooth appeal, she gets convinced. Sierra Leone in December 2022 revised its policy and reduced the age bracket to 12 years and above for those eligible for the COVID-19 vaccine. Because of this, schools are a target for the vaccination teams. At this primary school, after Matthias explained the rationale behind the exercise, the head teacher quickly led his team to mobilize the kids. Almost half of the pupils in classes 5 and 6 were found to be qualified to take the vaccine. Most of them had had at least the first dose. They were asked to get their vaccine cards from their parents for confirmation before one of the teachers accompanied them to the vaccination center. In neighboring Bo, Margaret Smith and her team are stationed today at the Milton Comprehensive Secondary School.
Prepare our movements plan every weekend. We target the schools and the community, the marketplaces. Yesterday we were at the New London market for the past 3 days. So today we decided to visit here because of the second wave.
The 5 facilities within the district, and all of those facilities are now undertaking COVID vaccination. And of recent, we have had an upscale in the cold chain. We have refrigerators in almost all those facilities now. So we have staff, and each PHU has a catchment area. So they cover their catchment areas, including hard-to-reach places.
Mohammed Shaw, District Operation Officer in Bo, is upbeat about the future.